Welcome everyone. Thanks for stopping by again. Once again, this is one of our mini clinics here at Stowell Healthcare. My name is Emmanuel. I'm your revenue cycle manager. I'm here to present to you another one of our special edition exclusively to which brought to you by Stowell Healthcare. This is our revenue cycle management mini clinics. In this special edition, we're going to talk about routine versus medical in optometry practice. And my name is Emmanuel. I'm your revenue cycle manager. I'm your coach, your advisor. Again, this is a full training, but I'm actually going to break it down to you in 5 minutes. This is one of the most complex, most questions asked in a medical optometry practice. Let's get started. Let's take a look on some diagnoses that may be considered as routine. We have hyperopia, myopia, astigmatism, hypermetropia, presbyopia, amblyopia. What does this mean? In the practice, a patient come in and says, I'm myopic, I need new glasses, I need a glasses prescription, I need to come in to have my glasses checked. More than likely, that would be considered as routine. Again, you coming in for contact lens refit, contact lens prescription, need glasses, new prescription for glasses, you presbyopia, you're getting older, you need new glasses prescription, all that to be considered as routine. Some medical diagnosis. Let's say, for instance, eye infection, keratitis, strabismus, Steiner eyes, keratoconus, dry eye syndrome. You have a corneal abrasion, conjunctivitis. You're a glaucoma patient, psoriasium, corneal ulcers, cataracts, chalazion. Those are common medical diagnoses we see in optometry group practice. Again, macular degeneration, diabetes, patients who are on plaque and nail, patients who had strokes, HIV patients. These are all considered as medical diagnosis, which means a patient who's coming in with two different insurance. One of them, if you have any particular reason you come in your chief complaint, the main reason for the encounter is one of these medical diagnoses, it is to be expected that your claim will be submitted to your medical insurance. And if you're a patient that has a high deductible, the money will be applied towards your deductible. It will be deemed as your responsibility. Again, the doctor has a duty of care to treat the disease, and the doctor acts to act accordingly. So if you have a medical condition, you are a patient, your claim will more than likely to be billed to your medical health insurance. Let's take a look at the type of insurance that are accepted. So we just talked about the routine diagnosis versus the medical diagnosis. Let's talk about some type of insurance here. Here are a list of some routine eye insurance I put together for you on a national scale. These are pretty common. Avisis, which is a small network. iMed, Superior, iMed is one of the top popular. iMed and VSP are probably two of the biggest. Davis Vision is also a big pair. And Spectera, National Vision. These are a partial listing of what is to be considered as routine. If you have a routine diagnosis, you come in for comprehensive eye exam, it will be submitted to one of these insurance if you had it. And also, it can also be covered at your medical insurance. We have a HMO. Some HMO do cover these routine diagnoses as well. Medical insurance, Medicare, Medicaid, Blue Cross Blue Shield, Aetna, Cigna, United Healthcare. Here in the New England, we have Harvard Program. We have Tufts Health Plan. We have Fallon Health Plan. We have WellSense. We have a whole list of commercial insurance. Again, these are lists of medical insurance to be associated with medical diagnosis. My name is Emmanuel. I'm your revenue cycle manager. I cannot stress the type of service here that will be billed to your medical insurance, such as surgeries. If you have eye injections, macular degeneration, you have diabetes, you need glaucoma surgeries, you have cataracts. The one thing I want to highlight here and put an asterisk next to it is post-cataract glasses may be covered by your medical insurance. And if you have post-retina surgeries, again, my name is Emmanuel. I'm your revenue cycle manager, your coach. This has been another mini clinics here to very quickly highlight routine versus medical and optometry practice. For some of my fans in India, Pakistan, Bangladesh, I want to thank you. Your comment is very helpful. We're going to continue to bring you more videos. In the Philippines, we have followers in Colombia and throughout Latin America. And I thank you for all your support. My name is Emmanuel. I'm your revenue cycle manager here at Star Healthcare. We continue bringing you these mini clinics as we're going to dissect and break down and cut to the chase and get to the bottom line of the revenue cycle management here in the US. Again, it's a complex, but together we're going to collaborate and break it down as much as we can. Again, with all the hands we put together, it will definitely be done. My name is Emmanuel. Thank you.